Hi friends, welcome to Plexus Ortho. My name is Dr. Kannan Kumar. I am an orthopedic consultant at Bangalore, and today we are going to discuss MCQ number 199 that we put up a couple of days ago in Telegram channel. So the question goes like this. The question was, in which area of the spine are osteoporotic vertebral fractures more common? So what are the osteoporotic? Even before we go into the question, which areas do you think the osteoporotic fractures occur more frequently? The most frequent part of the body where the osteoporotic fractures occur most frequently are the vertebral bodies. The second most common location, we all know, is the peritrochanteric area or the hip region. Peritrochanteric area. And the third most common region is the distal forearm or the distal radius region. And the fourth most common area where we have fragility or osteoporotic fracture is the proximal humerus region. So these are the four regions where this kind of osteoporotic fracture occurs most frequently. So let's go to the question. The question is asking which area of the spine this occurs most commonly. So we know they have given the cervical spine, they have given the upper thoracic spine, lower thoracic spine and lumbar spine. The correct answer among these is the lower thoracic spine. The reason why lower thoracic spine is most commonly affected with these osteoporotic fractures is that because it has less flexibility and therefore it is more easily amenable to compression fractures during injuries or fall from a trivial height. So these fragility fractures or osteoporotic fractures are so called because even fall from a trivial height or fall from a standing height is enough to fracture these bones, and that is why we have to treat them at an early stage so that these fractures don't occur. Osteoporosis is a very often repeated question in your exams, and at least one or two questions come in every exam, so therefore you must be thorough with this topic. So we all know what is the most common fragility fracture. We just discussed that the most common fragility fracture is the vertebral compression fracture, and among the vertebral compression fracture, lower thoracic spine fractures are the more common fractures. Now, how do we define osteoporosis? We define by the help of bone marrow density. How do we find the bone marrow density? We find the bone marrow density by two methods. The most effective method is the DEXA scan, dual energy X-ray absorptiometry, or DEXA scan. The second method is called the quantitative CT scan method. This also can be used. According to the DEXA scan, two scores are given: T score and Z score. What is this T score and what is the Z score? T score is the bone density matched to the young adult at the age of 30. So even if you are checking the bone density of a 60-year-old woman, you are comparing it with a 30-year-old woman. Z score is something which is age matched. You are comparing a 60-year-old woman with the normal population 60-year-old bone density. The WHO is using the T score for definition purposes. The T score -1 to +1 is normal. T score -2.5 to -1 is osteopenia, and T score less than -2.5 is described as osteoporosis. So this is the bone marrow density definition based on the T score that is compared with a 30-year-old young male or a young female. So what are the treatment options for osteoporotic vertebral fractures? We use what is called as a KT, or a Taylor brace can be used for pain relief. Usually no surgical management is done. Previous days, kyphoplasty and vertebroplasty were the treatment options. The kyphoplasty is basically you put in a balloon, inflate the vertebrae, put in some bone cement. It's called PMMA or bone cement, polymethyl methacrylate or bone cement, and you can inflate the vertebrae back to its height. Basically, we usually just help them with pain relief. Surgical intervention is out of vogue now. Previously, this kyphoplasty and vertebroplasty has been done. So these questions can be asked. BMD can be asked. Taylor brace can be asked. Kyphoplasty and vertebroplasty can be asked. All these questions have been asked before previously in your exams. So let's touch upon briefly what are the treatment options available for a patient who is diagnosed with osteoporosis. For osteoporosis, the first line of treatment is bisphosphonates. You can use any kind of bisphosphonate, alendronate, risendronate, zoledronic acid, which is given on a yearly basis, and ibandronic acid, which is given on a monthly basis. Multiple bisphosphonates are available, but many times they do not work well, and then we'll have to fall onto the second line of drugs. In case the patient is postmenopausal osteoporosis, then you can give hormone replacement therapy or relaxafen. This is second line of drug. Very important another second line of drug is teriparatide. Teriparatide is a 34 amino acid recombinant form of the paratha hormone, and when given in intermittent fashion on daily subcutaneous injection, it increases bone density. It has to be given over a period of 3 to 6 months. Once bone density reaches its normal level, you can supplement calcium and vitamin D and continue the treatment. The next second line or third line of drug is called denosumab. All of you know denosumab is a rank ligand inhibitor. It's a monoclonal antibody against the rank ligand. It inhibits osteoclast activity and therefore increases bone density. It is also used in some tumors, giant cell tumor. It's also used in giant cell tumor. Remember this, it has been asked before. Romosozumab is a new drug which is available, which is an anti-sclerostin antibody. It acts against sclerostin. What does sclerostin do? It inhibits osteoblast activity. So the inhibitor of osteoblast will increase, inhibiting the inhibitor of osteoblast will increase the activity of osteoblast and therefore increase bone density. In case of vertebral fractures, we can use calcitonin. It is used as a nasal spray. You use on either side of the nostril alternatively, and this helps in reduction of the pain. And of course, you should always use vitamin D, calcium and vitamin K. These are the three supplements that have to be given on a regular basis to the patient, so that whenever the osteoblastic activity is happening and bone is increasing, the normal ingredients for bone formation are available, like calcium and vitamin D. Okay, so that is the discussion about MCQ number 199. I hope it helped you. My name is Dr. Kannan. I am from Plexus Ortho. Thank you very much.